officials do expect that case count to rise dramatically after the Thanksgiving holiday, Chris.
Dasha, New York, unfortunately, has had a lot of experience. Obviously, the huge outbreak that we saw in April, May, a lot of experience in those hospitals. But talk about how people where you are dealing with this pandemic in Appalachia.
Yeah, Chris, there are some factors specific to this region that make battling this virus particularly difficult here. First, this is a largely rural area, so people are coming to hospitals like this one from many miles away, some as far away as the border of West Virginia. This is also a population with high levels of comorbidity, meaning people have underlying conditions like obesity, diabetes, opioid addiction, making them more vulnerable to be hospitalized and more likely to die from this disease. But there's one other factor that was a little more unexpected for the healthcare workers here, but that's making things especially difficult, and that is the crisis of misinformation. And for that, I want to bring in Chief Infection Prevention Officer Jamie Swift. Jamie, you've been preparing for something like this for the better part of the last 20 years. You've been through H1N1, you've been through Ebola. How is COVID-19 different, and how does misinformation play a role in this?
Yeah, this really is a different response. As we stood up our emergency response systems and our command centers to respond to this virus, we saw very quickly that the spread of misinformation was going to impact our response. We know that the spread of misinformation is costing lives. We have patients that may not come in until the last minute because they still just believe this isn't true. So as we respond to the virus, as a health system, we've had to very quickly develop a response to the misinformation. We've partnered with our local mayors, our local leaders, spent a lot of time trying to be proactive and really fight that misinformation so that people can understand, this is what's going on, help them understand this is the truth of the virus, and look to us to be a source of truth.
How concerned are you about the consequences of some of the gatherings that may have happened yesterday because people didn't heed those warnings to keep their family gatherings, their neighborhood gatherings more limited?
I really am concerned for our region. We are seeing higher cases each week. Our case counts continue to go up week over week. We have a high burden of virus in the community. So if there were lots of gatherings, we know that in 2 to 3 weeks, we're going to have even more hospitalizations, more new cases. And that's concerning of what could happen here over the next 4 to 6 weeks.
Jamie, thank you so much. And Chris, I spoke to a nurse this morning who told me she is seeing patients who are coming in with shortness of breath, who are being diagnosed with COVID-19, but just don't believe it is real. And that is posing a lot of challenges for the health workers here. Chris?
Dasha, I'm going to cause a little problem here because I saw Jamie walk away, but is she still there? Because I have a question for her. I think it's really important on this misinformation. If we could ask her, there are a lot of folks who have been told, wait until you get really symptomatic before thinking about going into the hospital because the hospitals are so overtaxed. What's her message to folks, not just in her region, but people who may be not believers all across the country, or people in rural areas who hesitate to go to the hospital? At what point do people need to seek help? What's her message?
Yeah, let me ask her that now. Jamie, our host Chris Jansing has a question for you. What is your message to people who might not believe in this thing and are waiting until the last minute, not just in this area, but all across this country, who at what point should they come and seek help to make the jobs